You're listening to the ATS Breathe Easy podcast, brought to you by the American Thoracic Society.
Welcome to ATS Now, on location from ATS 2026. I'm your host for today, Dr. Lekshmi Santhosh. I'm at the University of California, San Francisco, and I'm the current chair of the ATS section on medical education. So you both kind of touched on this concept of precision medicine and the better use of data as we look at our critical care population. And that kind of connects to the larger theme of the conference with AI, data science, big data. How is your own work and the work of other mentors and collaborators and mentees really contributing to that knowledge?
Well, I think in two spaces, so one is trying to get the questions a bit more specific and clinically actionable. And I think we're really getting there. And so we've got these really interesting ideas of syndromes that have moved to more like subphenotypes and thinking about whether those respond differently to key treatments. The other end of things is really the implementation science around this. So we have these great models, we have some early evidence that they might actually respond differently like we suggested, but what do you do with that? How does a team make use of that information? When do they need it? How do you bring that to them? And so seeing the science around that is really exciting.
That's great.
I think one big change that we've seen over the past few years really is that there's more and more infrastructure to do this collaboratively and at scale that didn't exist when Pat and I were starting our research careers.
View this full video at atsnow.thoracic.org.